Hi, everyone. Welcome. I know people are coming in, but we're going to get started as it is 1 o'clock Eastern Time. Thank you, everyone, for joining us. Happy Monday. My name is Gina Platanino, and I am FRAG SNAP Deputy Director. And today's webinar is we're going to be talking about the temporary exemptions to time limits. This webinar is being recorded, and you will get a copy of the PowerPoint and the presentations if you registered. For our agenda for today, I'll give a brief introduction into sort of time limits and what we are working with. And then we have our experts who really will hone in and really delve into what the exemptions, with the new exemptions that we have in terms of the military. Julie McCormack, the director of the Safety Net Project and Veterans Legal Clinic at Harvard Law School. Diane House, Maide Morales, the director of Resiliency Center at Worcester Community Action Council. Our foster youth, Jenny Packner, Senior Policy Director of U Law Center, and Stephen Oleander, the Senior Director on Strategic Policy, Think of Us. Then I'll open it up for some questions and answers towards the end, and we'll close it. One thing I'll say is that please feel free to put questions in the chat or in the Q&A, and I'll be tracking those so that our panelists can answer them once we open it up to everyone. So again, I'll go over a brief introduction, and then the next person that you see besides me will be Julie, and then our panelists will follow. We wanted to start off first with just really centering of how important SNAP is, not just for individuals who are hungry and need this as a resource, but it really is our nation's defense against hunger. In 2021, it helped over 41 million low-income individuals, and we know that with the pandemic, these numbers have risen with inflation, with everything that individuals are going through. But it does reach our most vulnerable population. It does reduce hunger, which is why we need to work extremely hard to make the program accessible and not create additional barriers. So what is this that we talk about time limits? And FRAG, we are very exacting and very intentional about making sure that we call it time limits and not work requirements, because SNAP has certain categorical eligibility requirements, but it also has work requirements that individuals up to the age of 62 have to meet, right? And these are ongoing. But what happened in '96 in the war on welfare was that at the end of the conversations as they were having, they snuck in SNAP and added these time limits, which basically said, we're going to make it more difficult for individuals to access SNAP. And President Bill Clinton, even at the last minute when he was signing this, did say that he was extremely concerned about these provisions of the legislation because it failed to provide support to children, to childless adults who want to work. And here's the key part, but cannot find a job or are not given the opportunity to participate in a work program. This was in 1996. We know that our economy is still struggling with a lot of issues, and individuals still can't find the necessary sources or document enough hours. So what is this time limit that we are referencing to? So it's basically benefits are limited to 3 full months per 3-year period, or 36. And they call this term that we do not like to use because it really is condescending, which is able-bodied adults without dependents. And the able, we're concerned about that because it leaves out specific populations and it makes many assumptions. Originally in 1996, it was done to 18 to 49. And our next line will go why there's been expanded now to 54. So these individuals can only get SNAP for 3 months in a 3-year period, unless they're working 20 hours a week, right? It doesn't take into account the commuting time, or that people sometimes don't have the resources to document it, or the waiting time. I flag this because we have a lot of people within our gig economy, and this is a big issue, right? Think Instacart driving, think Uber, think about the waiting time that happens in between. Is in qualifying slot, for example, employment and training, 20 hours a week, or doing volunteering. I just want to flag that volunteering, it really is a matter of privilege. And that for many organizations, they ask for various applications, they ask for transportation, and they also ask for, in some instances, for a background check, right? So it's incredibly burdensome to ask individuals to volunteer in order to be able to get SNAP, because if they could, they will be finding ways to not be on SNAP, right? Or they meet one of the limited complex exemptions. And one of these exemptions for quite a while has been those that have a disability. I flag that because we know for a fact that many individuals who are part of this community have been inadvertently left out, because asking those questions are incredibly subjective and it doesn't come with the resources to implement those exemptions. The harm of time limits is incredibly deep. You can go on our website and we can go on, but there's plethora of research, both from the human impact of how many people with disabilities, and that's the one we've been tracking because that was an exemption, have been categorically left out, but also from an economic impact where it doesn't improve the economy, it actually makes it worse. And again, I just want to put this out there that, again, this program, when they put time limits, it doesn't come with a job offer. It doesn't come with the resources. It doesn't come with transportation. There's no obligation under the SNAP time limit to make people be able to access this. And in some states, will do a better job than others and implement it. And in other states, it will make it even more difficult. Time limits are a mechanism to cut people from the program. They're not there to help or to encourage people to find more employment. Recent labor statistics show that majority of people have part-time or gig economy jobs and do express an ability to be able to work full-time. But unfortunately, there are no living wage, or there are not enough jobs currently in our economy to meet that. And what happens is that these individuals then end up in our food banks and our food pantries without being able to have the dignity of choice to be able to have SNAP to purchase the items that they themselves need for themselves. So what happened? There are a couple of things that have happened this year, and it's important to know that, as we talk about the state agencies that have to implement this, they've had a lot going on, right? We had at the end of the year in 2022, the omnibus was signed and emergency allotments were cut off. The state agencies had to figure out how to do that. And then in May 2023, we had two things happen. It was the end of the public health emergency, which meant that these flexibilities that have been put in place because of the pandemic, they were saying, we are going to stop this and we're going to give you 90 days so that people are alerted to what is happening. So what has happened is that individuals who were part of the time limits, they were giving a heads up to say, you're no longer going to be exempted. Time limits are going to begin. At the same time, there was budget negotiations. And out of budget negotiations, the SNAP program came as a bargaining tool, and it should have never happened. But as a result of that, the Fiscal Responsibility Act extended the time limits from individuals. So in 1996, it was set 18 to 49. With the Fiscal Responsibility Act, now is extending it to 54-year-olds, which is incredibly harmful. It also did allow certain exempted categories, which our experts will talk about, which is important. But I do just want to flag that these exemptions are temporary. They're going to be really difficult to implement. And that in the meantime, people are going to be cut off this program that is very needed. So we have July 2023, where time limits went into effect. There are some states that work really hard to flag that. And so the clock started ticking, right? Those 3 months that I mentioned. And now we have September. We're in the second week of September, which now is the expansion of time limits to now 50-year-olds. And now the new temporary explicit exceptions that allows people who are unhoused, who are in foster care to a certain age, and who have served in the military, to be able to be exempted from this time limit. Next month, the time limit age will increase to 51 to 52, and by October of next year, it will include 53 to 54-year-olds. It's important to measure the impact of time limits, right? We know that, for example, in the state of Kansas, right, when they re-implemented their time limits, the caseload went down. And this is at the crux of what we wanted to say, that time limits is really about cutting people, even though they are financially needed, off the program. And I wanted to just show this really briefly in terms of public attitudes, that the public, unlike the Hill, really, like most of the Hill, really feels that SNAP requirements should not be strict. They should be less strict. And that goes in between both Democrats, Independents, and Republicans. They feel that the program is already burdensome and that they should not make it as strict as it is. And this was a poll that the Disability Economic Justice Collaborative did, where specifically it showed that majorities of disabled and non-disabled voters support increasing access to food assistance after the pandemic ends. And as you can see across the line, there's strong support to increasing the access and keeping many of the flexibilities that we're giving during the public health emergency. And so I want to end this before I turn it over to Julie to say that right now we're in a farm bill year. This is an opportunity to say this is not working. And there are a couple of bills that will address this. One of them is the Closing the Meal Gap Act that not only tries to get rid of time limits to say as a whole, they're really burdensome to implement. It's really difficult to say which categories you're going to help, but as a whole, we should get rid of it. And on top of that, we need to acknowledge the SNAP benefits are not adequate. We need benefit adequacy. We need to ensure that there's a streamlined standard excess medical deduction, and we need to eliminate the shelter cap. This is the Closing the Meal Gap Act. And so we're really pushing for this during our farm bill. And this is HR 1510 as 2435, which is saying, let's just get rid of time limits. It's incredibly difficult to implement. Doesn't help the economy, it actually makes things worse. So it was introduced by Representative Lee and Senator Welch. And so we're asking this one, if your organization hasn't encouraged their representative to please sign on, let's get rid of time limits in general. And if you go to our website, we have resources that speak to each of these points. And here are various resources that FRAC has done, including showing the state impact of the ending of emergency allotments, how many tentative time-limited individuals will be cut off, and other resources that you may find useful. Now I'll turn it over to Julie. Thank you.
Thank you, Gina. And if you would move to the next slide, please, that would be awesome. I think that it is really poignant that we are talking about veteran hunger today, which is of course, the anniversary of the 9/11 attacks on the World Trade Center. And we know the implications for the lives that were lost then, including many veterans who served with the police and who served with the fire department, and then the constant war that we've had since then. And in the post 9/11 era, there are fewer Americans as a percentage of population and as a number of populations serving than in prior conflicts. And they have been deployed repeatedly. So it's a smaller percentage of the population bearing a greater and greater share of the burdens of war. And some of you, we know, bring your own experiences with the military and about these questions, whether your own personal experience or that of a service member, a family member or friend. And we really do invite your contributions to the discussion, and we welcome your perspectives. So this first slide, I really want us to be taught, and this sort of goes back to some of the things that Gina was saying about, the ways in which SNAP and the populations that rely on SNAP have been something of a political football here. When we're talking about veterans, we need to understand that it's a large number of people. We're talking here about 19 million people, men and women living in the United States and Puerto Rico, who've served on active duty, basically have worn a uniform, and that's about 7% of our population. But that is not the whole number. This is not a monolith. And the definition of veteran basically depends on who you're asking, which agency. Every single agency that veterans or folks who've been connected with the military are involved with have a different definition. Next slide, please, Gina. And so when we're asking who are veterans, we need to remember that there's no one veteran. And this is a really interesting article. This is from somebody at the Census Bureau in 2016, talking about how veterans are mostly older, mostly white, mostly male citizens. I mean, there are non-citizens who have served in the armed forces, and they're usually pretty educated with at least a high school education. But that's not, I mean, that is a stereotype, but that is not who all our veterans are. Some of our grandfathers, a high percentage of male veterans, very high percentage. Some of them are mothers or grandmothers. Some of them are co-workers. Some of them are college students. And so it's not a monolith. And I'm going to sort of drill down a little bit with this, because this is part of the issues that we're having with this sort of general category, this kind of this sense that, well, veterans are going to be exempted from the harm that's being imposed through time restrictions. Next slide, please. So thinking about female veterans, right? So the demographic of our veteran population, however it's defined, is changing, and it's going to change quite radically. So currently 1 in 10 veterans are male, but 9 in 10 are male, 1 in 10 are identify as female. And that's just going to be increasing. The racial diversity of our veteran population is changing as well. There are increasing numbers of folks who don't identify as white, who identify in other ways, with the implications that that has for the programs that serve folks that have been in the military. And flagging here that depending on who you are in that veteran population impacts your post-military experience. And we have statistics that show that 1 in 4 female veterans struggle with hunger, struggle with food insecurity. Next slide, please. Of veterans who are attending college, and there are a vast number. And again, these are folks who may not initially self-identify as veterans, right? So to get the protection of this exemption, you need to be known to be a veteran. There are over 1 million veterans who are receiving, the only way we know who's in college, who's a veteran, is their receipt of the GI Education Bill benefits. And as of 2020, there were about 1 million people. And 67% of student veterans polled report being food insecure. This is a huge population of folks who experience hunger. And we know that this is true across the board for folks who are in college, and veterans are no exception. And so again, we are skeptical about the ways in which something like this is going to address this problem. And then I really want to spend some time on the point that Gina was making here in connection with veterans. So when we talk about able-bodied adults without dependents, there's a presumption that these are folks who are able-bodied, and there is a presumption about veterans. There are some presumptions that also apply across veterans, but here we really do have to grapple with the post-service health implications for folks who have spent time in the military. And we know that there are many levels of harm and injury that occur in service. And we also know that that is tied to increased levels of poverty for folks. So many folks who leave the military are extraordinarily successful. They go on to be extremely successful in society, CEOs of businesses, in politics. But when we consider the impact of disabilities, both physical and mental, we see how many veterans struggle. And you see here for some of this data. Overall poverty rate, veterans are just under 12%, but that number jumps to almost 15% when you factor in a disability. And we see a disproportionate impact of these health implications falling on women, of people of color, and LGBTQ+ veterans. So again, it's much more nuanced when we're talking about these able-bodied adults without dependents who are potentially exempted when we drill down deeper on the numbers. And then again, we cannot be talking about, veterans cannot be in our view without talking about the number of veterans who lose their lives to suicide. 7% of the population in the United States make up veterans, but they make up over 20% of the suicides, and the numbers are much higher for female veterans. Next slide, please. And then, sort of within veterans that are unemployed, and it is quite hard. It's shockingly hard to find some of this data. But best figures we have are for 2022, and of the about 250,000 veterans who are unemployed at that point, you see these age ranges here, right? So we're looking at over half of them are up to age 54. But then when we really are thinking about this, who among those are actually able-bodied adults without disabilities, given the factors that I talked about previously? Next slide, please, Gina. So these able-bodied adults who are veterans, the carve-out here, I want to spend some time with the definitions. So because there's some extraordinarily good things about this, right? So as a policy, as a salve to the conscience, frankly, of the policy makers, they did some good stuff with this. So Gina, can we move to the next slide? You have it here. This is the definition. And so I'm going to break it down. So it's an individual, right? It's a person. No further definition required. Who served? And then this is quite special. So remember I told you that the definition of a veteran depends on who you're asking. Well, here they took away a lot of the weight of the places that individuals would not qualify as veterans for other programs. They included the Coast Guard and they included the National Guard. They included folks who are serving in the reserve components of the armed forces. And then they're looking at individuals who are no longer serving, right? So they're no longer attached to a branch of the military. But they're seeing them regardless of the conditions of their discharge. And again, this is incredibly important. If you understand anything about military culture, you understand that the circumstances of separating from service make a huge difference in considering even veteran status itself. Next slide, please, Gina. And then the other thing that we want to highlight here is that, again, as a salve to the conscience, Gina's already been talking about the extraordinarily burdensome elements of placing a time limit on something as basic as access to nutrition. But at least here, they did a good job with making sure that folks who want to prove veteran exemption from this time limit can do so relatively easily. And so I've listed here from the statute the kinds of verifications that the SNAP administering agencies can accept as verification. And many of these agencies are not used to this kind of flexibility, and it may well be that we are doing some advocacy around here. But even a driver's license that has information about veteran status can be accepted. Next slide, please, Jen, sorry. And then so thinking about, the need here, right? So we're carving out this exemption for veterans. Why? Well, it's a large number of people, as we talked about, but there's a huge number of veterans who are eligible. About a third of those who are potentially eligible are getting it, 1.5 million. But there's as many as almost 5 million veterans who could be receiving SNAP assistance. Next slide. And even the most low income, even the poorest veterans are not getting SNAP assistance. And so I just wanted to spend a little bit of time with what we call military culture and the ways in which that can intensify the stigma attached to applying for public assistance and can deter individuals from applying. So among other things, military culture prioritizes strength and self-sufficiency. It prioritizes loyalty and not airing your dirty laundry in public. It prioritizes service to others and self-sacrifice, not taking something for yourself that somebody else might need. It doesn't question authority. So when you're denied benefits that you applied for, you're not questioning necessarily. And then it sees a need for applying for help as weakness, again, increasing the likelihood that veterans will struggle, even if identified as eligible with so applying. Next slide, please. And then I just want to spend a little bit of time talking about whether or not this carve out, which is kind of a big deal, is actually going to do any good, right, in closing what we call the veteran SNAP gap. And Gina said it best. Time limits are just bad policy. It's burden shifting onto individuals, and because they have a difficulty meeting those burdens, it means they get kicked off of benefits. And many of the folks that we're thinking about as able-bodied adults without disabilities can qualify for exemptions with assistance, right? But the disabilities, all of the other factors that would exempt them are challenging for them to prove. And then just the myths about eligibility, right? So many people, and especially veterans, just don't know that they're eligible. They know about the food pantries near bases, near military congregational housing. They don't know about SNAP eligibility. And then finally, many people who have worn a uniform do not self-identify as veterans. Many people harmed by military culture, including folks who've experienced military sexual trauma, which is an absolute, essentially a pandemic within the military. So 1 in 3 female veterans, 1 in 10 male veterans, and then LGBTQ plus veterans, right? So we all know the legacy of don't ask, don't tell. It is still there in the ways that people have been harmed and the way in which they identify. Many folks with short or non-combat or US-based service do not self-identify as veterans. And then again, a large category here, an increasing category, folks who've been discharged under less than honorable circumstances, sort of colloquially called a bad paper discharge, may not identify as veterans. But that doesn't matter for the purposes of this exemption, because as we saw, basically any discharge, any separation from the military will qualify you. And so a point here that I really want to make strongly is not to ask folks, are you a veteran? Not to have you served? But some suggestions from our experience are, have you ever been in the military? Have you ever received military training? Have you ever worn a uniform? Next slide, please. So that's me done. Thank you.
Good afternoon. My name is Maida Morales, and I'm the director of the Resiliency Center for Worcester Community Action Council. And Worcester Community Action Council's mission is helping people to move towards economic self-sufficiency through programs, partnerships, and advocacy. It was started in 1965 under President Lyndon Johnson. War on poverty, and it is a federally designated, and we are the federally designated community action for Central Mass. I'm very happy to be here today. So first I wanted to talk a little bit about the new definition of unhoused folks. Oops, sorry. The new definition of unhoused. So a homeless individual is one who is an individual who lacks a fixed and regular nighttime residence, or an individual whose primary nighttime residence is in temporary accommodations such as a hotel or in a congregate shelter, a halfway house or similar situation that provides temporary residence for individuals. And it's temporary accommodations for not more than 90 days in a resident of another individual, so folks who are now couch surfing, and a place not designated or ordinarily used as a regular sleeping accommodation for human beings. And I think that these are very important, lots of advocacy that was done around these, because we had a lot of people who were not in proper places for habitation and couch surfing, and not counted as unhoused when advocates and work and community workers were saying that they were. So some of the rates of homelessness: California, Vermont, and Oregon have the highest rates of homelessness across the 50 states. About 582,000 Americans are experiencing homelessness, according to the 2022 Department of Housing and Urban Development. That's 18 per 10,000 people nationally, but in some states rates skew as high as 44 per 10,000. The vast majority, 72%, were individual adults, but a notable share, 28%, were people living in families with children. Next slide, please. So who's experiencing homelessness in 2022? Special populations. For reasons rooted in practice and policy, the homeless services world focuses on specific special populations of people experiencing homelessness. 22% are chronically homeless individuals or people with disabilities who have experienced long-term or repeated incidents of homelessness. 6% are veterans distinguished due to their service to the country, and 5% are unaccompanied youth, vulnerable due to their age. And I can tell you that while I was running the emergency winter shelter here in our city, we saw lots of individuals who have been chronically homeless, often with disabilities. And it was very difficult for people to be able to access the processes for applying for SNAP benefits and maintaining those. One of the things that happens is that you need multiple types of verifications and applications and interviews. And when you are on house, your encampment can be torn down. You often lose your documents and verifications. And so it can be a great barrier to accessing those. Oftentimes people have disabilities that including not being able to manage technology or not being able to read and write. And so those also can become a hindrance to people applying for benefits. So during the time that we ran the shelter, we had to request and gather documentation. And if you weren't born in the United States, in Massachusetts, in order to get an ID, we had to get your birth certificate. And so it was very difficult. And then if we add on to that, the expense and the money that you need in order to gather all of those documents, again, all of it barriers to accessing food and to accessing services. Next slide. So we have a lot of youth who are couch surfing. Oftentimes, people are getting assistance through nonprofits and CBOs, and often utilize those addresses for their applications. But we know that the turnover rate in nonprofits can be great. And so by the time the next set of documents reaches those nonprofits, and that person may no longer be there. And so then then there's nobody to follow up, and the mail gets returned. And so the person then loses their benefits. One of the things that I have done here in Worcester is that we have worked in collaboration with not only community legal services, but as a frontline worker, and we were a SNAP benefits outreach partner through UMass and DTA. And so whenever we had issues with anybody because of documentation or anything like that, we would work directly. We would do referrals directly to community legal services, and then they would, families and individuals would be able to get the legal assistance that was so necessary and so needed in order to be able to access their benefits. So one of the things that as an SNAP outreach partner, we always faced and was at assisting people with accessing their with the documentation. And so we worked really hard at talking with people and, following up with some folks and letting them know what the process was going to be in order to be able to get their SNAP benefits. So time limits are a great hindrance. Having to reapply every 3 months, it's a great hindrance. And, it creates a huge barrier for people to be able to access healthy foods. So.
Hi, everyone. I think I will go ahead and get started. My name is Jenny Pokempner. I work at the Youth Law Center. We do legal and policy advocacy for youth in and leaving foster care and the juvenile justice system. I tend to focus on older youth issues, youth and young adults, and I will pass it to my colleague, Stephen.
Hi there, and I'm Stephen Olander. I'm the Senior Director for Strategic Policy Initiatives at Think of Us. We're a research and design lab for the child welfare system that's built around the idea that we need to fundamentally reform the systems that we have for serving children, families, and communities, and that at the center of any of those conversations, any of that reform needs to be the people who have been impacted by those systems. So we can go to the next slide. Just a little bit of background on the populations that we're talking about in foster care. Every year, nearly 20,000 young people age out of foster care, which means that they reach 18 or 21 in certain states that have extended foster care, and that they reach 18 or 21 without either reunifying with their families or entering into a new permanent family through adoption or guardianship. And unfortunately, our system is designed in ways that mean that most age out without a strong supportive network of supportive adults. Often without a network at all, because foster care makes it very difficult to build and to maintain relationships. And we know that the period of transition to adulthood is a really critical one when youth, for the first time, are left to solve things on their own, to really build their futures. And that's a difficult time for any young person, paying bills for the first time, cooking for themselves, living on their own, procuring their own food, figuring out who they are, which is an important part of the transition to adulthood. But it's an especially difficult time for youth who age out of foster care for a few reasons. The first is that foster care does a pretty terrible job at giving opportunities for stability and normalcy. So many young people age out having been largely prevented from having jobs, from being in control of their own money, from things like learning to drive, to cook, to shop for themselves. And when they age out, all of that is suddenly thrust on them at 18 or at 21 when they leave. Also, they're navigating all of those things often with massive amounts of trauma, both from whatever events led them to enter the system, and also from the system itself, which can be hugely traumatic for young people. And as I said, they're often balancing all of that without social support. So it's not surprising that we see young people aging out of foster care having pretty abysmal outcomes, with extremely high rates of homelessness, of poverty, of incarceration, food insecurity, mental illness, other things as a result of their time in foster care. SNAP here can be a lifeline because it takes one of those things off the table. If they're navigating so many things for the first time, it means that they at least don't have to worry about being hungry. And that gives a little space to focus on all of the other things they have to balance. And I'll say one more thing, and then I'll pass it over to Jenny for our next slides. People ask why this population is different and special when so many are struggling, especially when it is a comparatively smaller population to the other ones we've talked about here. The fact is that these young people were in foster care because our government actively made a choice to step in, intervene, and separate them from their families. A conscious choice was made to upend their lives, and in doing that, there is an implicit promise that we're going to provide something better, something safer, and something that promotes their well-being. So we have a special responsibility to these young people, and the very fact that they have aged out of foster care means that we have failed at that responsibility. So easing the pathway to SNAP benefits in this way, it is wildly insufficient to help youth make that transition to adulthood, but it is a really important step and a historic step. So I'll pass it back over to Jenny.
Thanks, Stephen. And next slide. We did want to get started with the definition, and we really do appreciate today the focus on language. We wanted to share that I think, to use person-centered language, we tend to say youth with experience in foster care rather than calling a young person a foster youth. Foster care is a significant part of their history, but it is not the only part of their life. So that's just one thing on language to be aware of. We quoted on the slide what the time exemptions are with respect to youth in foster care. So an individual who is 24 years of age or younger and who was in foster care under the responsibility of the state on the date of attaining 18 years of age or such higher age as this state has elected. And that is electing is extended foster care, which is 18 to 21, which, as Stephen said, many youth leave care at 18, but some who are in states, and the majority of states now do have extended foster care, could leave anytime between 18 and 21. Next slide. We're going to dig a little deeper, though, into that. First, we did want to make clear, we understand that there's nothing magic about age 24 or 25. We know from the research roughly between 24 and 26 is when, on average, young people kind of transition to the adulthood in the sense of kind of being on their own and separating their own households and that sort of thing. But you all know from your own kids, we all know from our own backgrounds, I mean, it really is individual. And so it could be anywhere from early 20s to late 20s. And the other thing also to know is, as that age really is no magic number, the time at which a young person heals from the trauma of being in foster care, and as Stephen said, is what led them to foster care, that also doesn't magically end at any certain age. So a young person you're working with at 28 who has a foster care history also might have these same challenges, but we're just focusing on what the statute has allowed us. But what we did want to include what is included in this definition. And I think it is important to know that it would be any youth who was in foster care anytime between 18 and 21 and who's under 25. And that does mean a young person in what we call extended foster care. That's just foster care 18 to 21. Even if they're still in foster care, they would be eligible because they were in foster care when they turned 18. So knowing that you're going to have a group of young people who still might be in foster care, and that's okay, that they'd be eligible. The other thing we did want to note is that youth are mobile, young people are mobile, and a youth who meets all the other criteria but was in foster care in another state, they're also eligible as well. And so those are just some of the things we've thought through in terms of thinking about implementation. We're sure others will come up. We're happy to answer those. We know FNS has their FAQs, so encourage you all to ask those questions just to make sure this is as inclusive as possible. The other thing we did want to note in that last bullet is just when we say foster care, we understand that people can mean a lot of different things. And really, under this definition, it's foster care through the child welfare agency. So for the child welfare agency doing a placement with a kinship caregiver, a group home, a foster care family home, supervised independent living home. But that does mean it's not going to capture youth who are informally placed in kinship care, unfortunately. It's not going to capture a youth who left foster care at 16 or 17 before 18. So just wanted to clarify that this is not going to cover all young people who might say, I was in foster care, but it is going to cover a good chunk. The other thing to note just about the overlapping of this exemption with the homeless exemption, the unhoused exemption, is that as Mady noted, you're seeing a lot of young people who are homeless or unhoused, and you might have a young person who's applying for SNAP and who is maybe 19, and maybe they said they left foster care at 15 or 16, and you might say they're not eligible for that exemption, but you might ask them about their housing status, if they're couch surfing, and maybe they fit in that situation. So just want to note there is some overlap there. We appreciate the foster care definition here. It does give us some flexibility, but certainly it's not as expansive as we'd like. And again, I know Stephen and I are happy to answer questions for people when you're like, does this fit or does this not? And as we said, hoping FNS is going to help clarify as things come up. Next slide.
So we want to talk a little bit about verification of foster care status. And the good news is there are no new requirements here. FNS has made it clear that a young person's statement that they were in foster care should be counted as proof that they were in foster care, unless there's a specific reason not to believe them. The goal with this is to be as accessible to youth who are eligible as possible. If things are more onerous, they're likely to not be able to take advantage. And I'd say by definition, youth who have aged out of foster care are people who have been failed by government systems that were meant to support them. So it is really important that we are responsive to those circumstances. I'll also say, given the stigma around foster care and youth who aged out of foster care particularly, it is far more likely that a young person would refuse to disclose that they were in foster care than it is that someone would falsely claim they were in care. So we should be believing self-attestation. And SNAP agencies should take that self-attestation as proof unless there's a really compelling reason not to, and FNS was very clear about that. Go next slide. In the event that there is a compelling reason not to believe a young person's self-attestation, FNS has also made it very clear that state agencies must support young people in obtaining verification and must accept any reasonable documentary evidence. So as it says here, that can be information from other programs like Medicaid or TANF through different data sharing agreements. Youth who were in foster care at 18 are eligible for Medicaid until 26, so the Medicaid agency should have that information already. But what is often better is accepting a statement from others. We've listed independent living coordinators and foster care programs here, but I'd just like to kind of emphasize that other people familiar with the young person's circumstances are often the best way to go with this. If you do have a compelling need to ask for verification, to go there first. Young people we have seen will often turn down support if they know that the child welfare agency will be contacted, will be involved. For our independent living Chafee services, that are available from foster care. Less than a quarter of eligible youth take advantage of transition services that they're eligible for every year. Less than half ever take advantage of services. And there are many reasons for that, but a main reason is for many youth, when they age out of foster care, they never want to have contact with the system again. Many see their time in care as traumatic, as coercive, and so they don't even want the system to know where they are. I've spoken with young people who liken it to escaping an abusive relationship where you're willing to give up a lot to make sure that that person can't find you. And so if people know that the child welfare agency is going to be contacted, they are less likely to take up these services. And we know that with every additional layer of verification that's added, we're going to lose young people, which is why the strong default here really needs to be self-attestation. And as FNS makes clear, in the cases where that self-attestation is decided to not be acceptable, we really must accept any reasonable documentary evidence and err on the side of trying to help young people access this. I'll pass it back over to Jenny.
Next slide. Thanks, Stephen. And we just wanted to share, Stephen gave a couple of best practices already, and I think they really do reflect kind of what we know and what Stephen shared about the experience of young people in foster care. And also, as you all probably know, as we talk with our colleagues, very few people know about the existence of this exemption. And as Stephen noted in one of the first background slides, a lot of youth are eligible for SNAP, but aren't receiving it. So we really hope some tailored outreach will be something that you all on the call, that FNS and our state kind of agency partners will collaborate on. And we're also, us who work with young people and advocate, we're happy to help. But definitely we do want to tap on the child welfare agencies who are working with youth, particularly those youth who are 18 and older and are about to age out or are still in extended foster care. Independent living programs is a program within the child welfare system, and sometimes people call it the Chafee program, Chafee services, that particularly focuses on older youth, and we really want to tap on their expertise. Also, the Medicaid agency, youth who were in foster care are categorically eligible for Medicaid until age 26. And this is slightly similar in that they had to be in foster care at age 18 or older. So the Medicaid agency is already providing Medicaid for some portion of that will overlap with those eligible for the SNAP exemption. So working with them, many, when you look on your websites for Medicaid, you'll see they've created pages for youth who've left foster care. So they might, collaboration with them, I think, is a great idea for outreach, and we'll talk about also for verification. We also encourage all of you to collaborate with agencies, outside of the state or county agency that are working with young people in this age group. So again, Chafee service providers that might be in the Community Workforce Investment Act programs targeted on youth. Also, providers working with homeless and young adults who are homeless, transitional housing. And of course, most of your states have youth boards that are connected with the foster care system, but they might just be connected with youth and young adult services, and they can be a great ally both in understanding the best way to do outreach and communicating with young people. And we really do encourage you to do youth and young adult friendly notices and communications. We know that there's a model notice toolkit that gives you kind of a baseline to build from, and we're happy to work with you. And also those youth boards are great places to go and ask them to consult with you on communications. Next slide. And Stephen talked a little bit about verification, and we'll add a couple more things about screening and verification. We definitely encourage training of caseworkers on the interviewing and screening process. We know that they're going to be talking with those who are applying and also recertifying about the various exemptions, and understanding some of the things that Stephen mentioned about working with a young person, understanding that they might be reluctant to self-identify. There's certainly, as we mentioned, other benefits that they can receive Medicaid, some higher education benefits where they are encouraged to self-identify. And so some things we've learned that are successful, and again, are probably similar to what you would do with the two other populations talked about today, is explaining why you're asking that question, explaining that it's to help them connect and stay connected to benefits, and also that the information is confidential. It's only being used for the purpose of eligibility. I think those are really important. And if you have the flexibility, I saw one of the questions in the chat around, like, if you are going to change your applications and you're electronic and you kind of have the options to do some hovering to say, why am I being asked this question? Those, I think, have worked really well. So if you have the technological capability to even kind of have those float in to applications, that would be awesome. But certainly a screener being equipped to say why we're asking this, and that'll be confidential, is really important. And again, really asking, really relying on a young person's statement about verification of foster care history, we think is really essential to this exemption working well for young people. Again, I won't repeat what Stephen said, but I think it's absolutely true. Young people aren't going to be young people, their connection to their foster care history, like we said, is it's a piece of their history, but often it can be a very painful and impactful piece of their history. And the more we ask them to kind of go back and reconnect with child welfare or have to restate things, I do think we push them further away, not just from SNAP, but other services. So really do encourage everyone to stay strong. That FNS guidance, I think, is really strong and really clear that this is acceptable, the self-attestation. So hope we all can kind of be pushing that. But again, Stephen's agency is excellent at organization, excellent at doing, knowing the best outreach strategies, reaching out to a lot of young people. My agency is happy to help as well. We're connected with a lot of youth serving agencies, so can help with that as well. On the last slide we did, thanks Gina, we put excerpted for you. I know you all have read the guidance and the FAQs, but just pulled out the foster care specific ones, and then put a couple of resources if you do want to learn a little bit more about background of youth in foster care, and also some of the state data for you. And thanks again for letting us be part of this webinar today.
So thank you all. I'm going to ask our panelists to go back on video. We have a few minutes, and I just want to make sure that we get at least one question in. And I think, Lindsay, your question of what can we do at a state level to show advocacy support, I just want to take a moment, because you saw how our panelists really struggle condensing so much information in such a short period of time, because this is overwhelming. And I need you to take a pause, because these state agencies are being asked to do the same thing through millions of people, but then also at the same time expanding the time limits. So what you can do, you're really gonna have to be involved. I mean, Jennifer and Stephen said, we're willing to help. You take those recommendations. Jennifer, I think you submitted some recommendations to FNS, right? If those are public, be really useful. I'm happy to share them as a follow-up, that you submit that to your state agency, because FNS guidance is guidance. It's guidance. States still have the choice to decide what they're going to implement, right? And I will flag that when we say whether it's subjective, I will flag equity. We do know that people of color do face more implicit bias. And so will people of color be most likely to submit verification? We've seen it in jobs and housing. So it's something that we just need to flag out there, and that we need to make constant, we need to put it for the state agencies to know, and work with your state agency. If you're not part of a coalition, definitely contact us. We can see who is the main person in your state that's doing this work. But that will be my main thing, to work with the state agency, because you're just drafting it. Remember, I said this happened in May, and FNS literally just 2 weeks ago said, these are the second set of questions. They are developing this as we go, and it's better to start strong with really strong recommendations than pick up the pieces as like questions come up. So just wanted to flag that for individuals, and I'll give our speakers just one last minute or 30 seconds to add anything else that they may not have had a chance. 1 second, actually, I do have a question here. Oh, so here's the thing. So yeah, it's around applications. And I would say that the question is whether in their particular state, there's no one question asking if someone has been in the military. They do ask it on the online application. And I will say that, you know, for paper and online, it does differ between states. But I have heard from other states as well that they are not putting anything on the applications this year because, again, it's so cumbersome and problematic. So we're going to start seeing that next year. But keep in mind what both Jennifer and Stephen say about, you know, the specific population in youth, people-centered, youth-centered language. Maybe how do we ask that question? Same thing with Julie. Have you been in the military, right? And so to think about what it means when you're speaking with a someone who identifies as a female or someone for a particular population and what that means. So now I really will give you your 30 seconds to close out this webinar. So Julie, do you want to get started? We'll go around. If you have nothing else to add, that's okay as well.
No, thank you. I'm glad that you addressed that with respect to the veterans application. I will say that I can't offer a ton of help, but I'm happy if folks have individual questions. I did not spend time introducing myself, but I do a lot of direct service with veterans, very low income veterans and others. And so that's a big job. And I really appreciate the work that Jennifer and Stephen put in with respect to recommendations. Those apply across the board. You just switch in who it is you're centering. And so that's excellent resources. Thank you.
Just real quick, I would say that we all need to remember that this is a basic need that folks have. And so we should be breaking down barriers rather than setting them up. Thank you.
Jennifer, Stephen.
I took too long, so I'll let Stephen go, but thanks for including.
I would say again, self-attestation. That is something, you know, it's guidance from FNS, but states will be able to implement how they choose to implement, as Gina said. So we want to push for that. And then I am very much a believer in the if you give a mouse a cookie school of public policy, wherein we say, thank you for making these exemptions. They are not enough. Now we would like more changes to make sure that more young people can be more young people, more veterans, more everyone is able to access the benefits they need to be able to thrive, because we should not live in the richest nation the world has ever known and have people who are hungry. That just should not happen. So,
Stephen, we should hang out. I love what you say. I will add this, that everything Stephen say, +1+++1. I'll also say we'll send you the PDF. And remember that if we can do things at application time, it would be better, right? If I can just check off the box, let's try to work on that and those applications as they're being drafted. And also, especially with these specific populations, if you can get them in and get the interview out of the way instead of having people to come back, that will be incredibly useful. And the best thing is just get rid of time limits as a whole, right? I think for your particular population, Stephen and Jennifer, there's no magic number, nothing like their life doesn't change at 25, right? The circumstances are the same. Ideally, they will improve, but not necessarily. So let's keep flagging that. And like, we still have an opportunity in the Farm Bill. Let's just get rid of time limits as a whole, because this is an administrative burden that that states have to spend money implementing and now reaching out to community partners, and we can better utilize that money to make SNAP more accessible for everyone. So thank you all so much for attending our webinar. We will go ahead and send you a PDF of the presentation along with this recording, and please feel free to reach out to us if you have any follow-up questions. I hope everyone has a wonderful Tuesday. Take care of everyone.